Ladies and gentlemen, the February 15, 2024 Board of County Commissioners meeting is now called to order at 6:30 p.m. If you would rise with me. Heavenly Father, I come with thanksgiving on my heart because each new day you awaken us to is a gift from you and a new opportunity to do your will, to do good towards others, and to serve our community as leaders and to be examples of your will. For that, I am eternally grateful. Heavenly Father, we thank you for each person who has come out in person and those who are listening online. Please help them all and bless them. Now, Father, I ask that you guide our behavior and actions towards each other as we display civility and courtesy and respect to one another, that we keep an open mind, and as we are receptive and try to understand the viewpoints of each person. Father, I ask that you please keep your loving arms around America, and particularly the innocent, our children and adults, who are too often caught in the perils of violence by those who choose evil, gun violence, and those who show hate rather than love. Help us, dear Lord, to always choose nonviolence and Lord, to always choose love over hate. Now, Father, guide us in our decision-making tonight, that it be done in the best interest of the community and be pleasing in your sight. In Jesus' name we pray, amen. Let us pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, we will have our public hearing, and I'm going to turn it over to our attorney, Mr. Commando, who would explain the action and the resolution that we're voting on tonight.
So, Madam Chair, this resolution is really the collection method should an assessment be put into place. This doesn't actually levy the assessment. This is just the method by which it would be collected. So, without this resolution, the county would have to essentially set up a group of people that would send out bills and then collect those bills. And then if there were any properties that could not be collected the next year, they would be put on the tax bill. So this is just a way to streamline efficiencies for the county.
Thank you for explaining that. Are there any public comments regarding this resolution? Okay. Any questions, comment from the board? All right. At this time, I'll call for a motion.
Read the resolution.
Did you have?
We just need to read by title.
Okay.
So I can do that. A resolution of the Board of County Commissioners of Bradford County, Florida, electing to use the informed method of collection non-ad valorem special assessments for more than 1 year, levied in Bradford County, Florida, to fund the cost incurred by the county in providing fire protection and emergency medical services each year, stating the need for such levy, providing for the mailing of this resolution, and providing an effective date.
Okay. Any comments from the public? Board? All right. I'll call for a motion for approval.
Make a motion to approve the resolution as read.
Motion by Commissioner Doherty. Is there a second? Second by Commissioner Reddick. Okay. Are we ready for a vote? Any discussion? All in favor, sign aye.
Aye.
Any opposed? It's 4-0. And please, again, for the record, note that Mr. Thompson is absent, so we have an unanimous approval. Okay. Now, moving on to public comments at this time. We have a few coming, and the first, Mr. David Ross. And again, whoever is coming up, if you would speak directly into the mic and just state your name and so forth.
My name is David Ross. I am a resident of Bradford County, long-standing. Thank you for this time to speak to all the people in authority here. Thankful to all of y'all, and I just want to say that tonight I'm speaking on behalf of Purpose Behavioral Health. and I think that's going to be on the agenda tonight. It's the vision of one of the most successful people I know, and that's my wife, Bertina Hutchinson Ross. And I've gotten to know her over the last 2 years, just her dedication to people, her dedication to what's been spoken to her as a vision. I woke up this morning, I'm also a licensed LPN. I've been an LPN for about 2 years. So I get the chance to work in this community and surrounding communities with people and help them to have a semblance, a better quality of health. And I just tell you, today when I woke up knowing that I was going to be able to speak on behalf of my wife today gave me so much joy, because this has been her vision. This has been something that's been burning inside of her that she wanted to see come to pass. And just being able to speak, just being able to propose this tonight in front of friends, family, and the community is a dream come true. And so I just pray and hope that everyone listens and hears this clear vision of how we can do some change, some preventative things, and think outside the box here for our community when it comes to opioid addiction, when it comes to giving people second chances, when it comes to really seeking to make a difference in this county. Thank you.
Thank you, Mr. Ross. And, excuse me. And next we have Ms. Cynthia Ross.
Good evening, everybody.
Good evening.
And I do thank you, commissioners, for your service. And I'm so thankful to see Commissioner Spooner, being here tonight. And thank God that you're on the mend.
Thank you.
I really had no intention of speaking. I'm here in support of anything we can do more in the area of mental health. However, I thought I would take the opportunity to share just something that we're doing, a small effort, but hopefully it will grow. We do just need more positive, productive opportunities for our young people and just for our community in general. And I thought, what better place? Because I know that you're concerned about a community. So I'm just going to read what's on these little sheets. It simply says, do you have a talent or skill that you're willing to share with others in our community, and to do so in an environment that honors God? And then it says, if you answer yes to this, who to contact, and that would be actually me. Then on the flip side, it says, do you want to grow as a person by learning a skill or developing an interest or talent, and do this in an environment that is safe and honors God? No age limit, but youth have a priority. So I have these little flyers that I'd like to share with each one of you. I wish I bought a lot more so I could give them to everybody. But I have the first person that responded to me on this, and I just really got started. And I was so excited just in talking to her. She said, well, I said, what do you like to do? She says, well, I knit. I don't know how many young people are learning to knit, but what a great thing. So we just want to match talents with people that want to develop talents and abilities in an environment that honors God and that is safe. So I just want to share that tonight, and thank you. And I'm very much in support of whatever we can do to advance mental health here in our community. So can I hand each one of you one of these?
Sure. Thank you, Ms. Ross.
Thank you. Here, I'll give her one.
Thank you.
All right, thank you. And next we have Mr. Tommy Tatum.
Board, I'm here about the oncoming fire attacks, and as you notice, I didn't come when y'all voted the electrical one because it was fair. And I'm not here on a crusade against taxes, but we do have a lot of buildings at the sawmill, and we do work a lot of people, and we don't judge them. I don't even check a person's record when I hire them. And if they do right, I work. But hard times is here, and when you start looking at buildings your daddy built, and they could be called commercial buildings. This is all about protecting the big man. We got a big sawmill building. 25 people on it all times. 5,000 amp worth of disconnect, 2,2500s. It's gonna be taxed the same thing per square foot as some building about to fall down a mill yard. Now, I'm gonna tear the building down, but I'm gonna be bitter about it when I do it. And so really, it's your job, maybe you got to have electrical tax, but it's your job to do things fair. And when you take a building that's worth absolutely nothing and tax it the way you do something that's worth millions, you might say, it's not right. And, you know, it's just not right. And I think when you do something ain't right, it always comes back to haunt you. Do you want people saying Bradford County ain't right? I mean, start with, I talk to sawmillers all over the country, and our tax would be about $95,000 a year if you taxed every one of them old buildings. I can tear them down. And each time my men have to clean up the mess, I'm gonna blame it on the county commissioner when I do it. And some of them pretty big men. Most of them are big enough. I always say I can go anywhere I want to with them and come out the other side. Nobody will bother me. But I'm not against, you know, I realize, and I'm really, Tatum Brothers Lumber Company is definitely a sitting duck either way. We need the fire department, but still a $95,000 a year fire tax is unbearable. And so it's y'all's job to come up, and I don't know why Clay Electric wouldn't pay Bradford County no attention. I guarantee you if Clay County had done that, they'd have done it, or Alachua County. And so we've already been looked down on, or Clay Electric would have done it. And that was a fair tax. And we're about a $17,000 a month light bill when it's bad time right now, probably $20,000 when it booms up. So we would probably be around $10,000 a year fire tax. I didn't even come down here to fight it because it was fair. Everybody would pay it, including RV parks. When they had the $1 million campers they hook up, they'd pay it, or the mine, like the DuPont mine, whatever they call it now. Everybody would have to pay their fair share. I'm not against fair tax. I realize you got to have fire. But when you do something that is anybody, I've even asked Kenny Thompson Boyd, did he agree with taxing all them buildings, same with that sawmill shed? He said no. And I asked Norris, she said no. Nobody agrees with it. So when you start a tax that nobody agrees with, you've got to do something different. And I'm not telling you how to do it. That's y'all's job. That's why I don't want to be county commissioner. But anytime you do something when it's common sense can tell you it's wrong, it always is wrong, and it always comes back to bite you. And I'm sure, you know, the rich man needs to pay his fair share too. And we could tear all our sawmill building down and put $4 or $5 million dry kill in, and would have a way lower fire tax, and yet have a lot more danger, need the fire department a lot more. So, you know, everybody needs to pay their fair share, including the rich man. And y'all need to keep that in mind.
Thank you, Mr. Tatum. Next, we have Ms. Strong.
My name is Vyanja Strong, Post Office Box 530, Lottie, Florida. I came tonight and kind of like Mr. Tatum was alluding to, I pay my fair share of taxes. I pay my $125 a year for the assessment in the city and the county, and I pay the $120 for my trash pickup. And it doesn't seem fair to me. I can't tell you that I've ever been to the dump, but I paid that assessment. Now I'm gonna have to pay an additional if you decide that you want to assess me for the fire. I love those guys. Because I want rescue to be where it needs to be, when it needs to be. If I take my glasses and hat off, you'll see that my face is swollen, my eyes are swollen. I went to the emergency room. They gave me something that I don't know what they gave me, and I had a reaction. So I'm all swollen. And if I need those guys, I need them to be where they need to be, when they need to be there. So I want them to be around. But I'm being double taxed as it is on trash. That's a big bill for me. There's one person that lives in my house. I don't make enough trash for the one person that I'm paying for, let alone for a house full of people. But I'm paying for, Lord knows, enough people for trash. I pay it. But you're charging me for a lot of people. if you put the tax on for fire, I'm going to pay for that too. I have no choice. Second thing, you're entered in an agreement with the sheriff's department where he took over for the city. Who's going to pay for that? The county. We're going to have to pay for that too. Down the road, we're not going to be able to afford that, but the taxpayers. Nobody asked if we wanted to take over Stark Police, but we're going to have to pay for that. Sooner or later, that money is going to come from the taxpayers in this county. Just the same, because we have to pay his budget. But nobody came and asked the taxpayers in this county whether or not we wanted to take over for Stark Police. But we're going to have to pay that. And I have a problem with it.
Thank you, Ms. Strong. Did I miss any public comments? Okay, thank you. Now we're, agenda item number 4 is the approval of the consent agenda.
Make a motion to approve the consent agenda?
I have a motion on the floor by Commissioner Doherty
Second.
and second by Commissioner Andrews. Are there any questions? All in favor? Sign aye.
Aye.
Okay, no opposed. It's 4-0. Agenda item 5 is the appointment of representative to the Swanee River Economic Council Board of Directors. And we did have a recommendation in our packet. Is there a motion for approval of the recommendation in the packet?
No, we didn't. I think that we. Is she going to continue?
No, there was a recommendation for Ms. Johnson. Has she agreed to continue, to your knowledge?
I'm sorry, Madam Chair, say that again, please.
There was a recommendation for Mrs. Johnson, and that she's agreed to continue.
There's no recommendation. There's just a letter here stating that she currently has held the position previously. So
Okay.
if it could be your decision to leave her in that position if you choose.
Okay. I would recommend to the board to allow her to continue. She's done a good job and has served for a number of years,
I agree.
if you don't mind.
I just need someone to make a motion.
Okay, we have a motion.
I make a motion that we continue with her.
Okay, motion by Mrs. Andrews that we continue with Ms. Janice Johnson. Is there a second to the motion?
Second.
Second by both. Mr. Reddick. Any further discussions, questions? All in favor to sign aye?
Aye.
Any opposed? It's 4-0. Thank you. Now, item 6 is the proposals for the opioid abatement funding. We'll have a presentation from the Meridian Behavioral Health. Ms. Ashley Torzor is here, followed by the Purpose Behavioral Health, Ms. Patina Ross, and then followed by the Bradford County Health Department, Ms. Amy Udi, and then from the Community Resource Paramedicine proposal by Mr. Carter, in that order. So, welcome, Ms. Torzor. Is that the correct one? Ms. Tozier, okay. And again, when you're presenting, if you speak into that mic so that they can hear you.
Yeah.
Online.
Okay, I am a little soft-spoken, so I'll make sure that I stand close here. Hello, my name is Ashley Tozier. Okay, is that better? My name is Ashley Tozier. I am here on behalf of Meridian. I am our Senior Vice President of Medical Services, and so I oversee our MAT clinic, which includes substance use services. And that's what we're going to be focusing on tonight. Commissioner Spooner and I spoke some before I came here today and created this presentation to talk about the amount of dollars that may be potentially allocated to us, that it appears would be around $200,000. And so what I did is created a presentation based upon that and what we could do with that. We, of course, are working with other counties within North Central Florida to spend these dollars, and this is just what kind of the way the services are going across the board in the state of Florida. So again, this is specifically for year 1, 2024, which is the most amount of money that you all will be receiving. And so I am going to go through that. This, of course, is our site here. I come to find out it appears this has been, we've owned this for 40 years. In 1984, we acquired the building, and to be honest, I couldn't find a date that we actually started services, but we have been here for 40 years. Unfortunately, up until this point in time, we have had no dollars to provide substance use services. So mostly what we do is outpatient psychiatric treatment to include counseling, group counseling, and then outpatient psychiatric medication management. So looking at an overview of the substance use services that we could provide, we're going to look at some in-office services, jail bridge program, hospital or emergency department bridge program, community bridge program, and then co-responders. So our in-office services, is it bad that I'm looking back? I wonder if I should stand this way.
To the angle and then angle you're good.
So our office services would consist of a counselor, an APRN, which is an advanced registered nurse practitioner, and then a peer support. So in these cases, an individual would actually come into the office and be seen in person. The way the monies would allow, I have allotted for a part-time APRN and then a full-time counselor and a full-time peer to meet that 200,000-ish budget. So how that would go is an individual would be scheduled to come into the office, and they would first be seen to assess for the need of substance use services and what that looks like. Oftentimes when we're talking about substance use services, and more specifically opioid use disorder services, we're talking about MAT, which is medication-assisted treatment. So it's a combination of medication and then also therapeutic supports, therapy, peer supports, and so on, all working together. And it is required that the individual who's enrolled engages in all of those different types of services to be compliant with the program. So from there, again, they're going to be seeing a counselor to complete an intake assessment and provide ongoing individual and group therapy. They would see an APRN who would assess for medications. Medications, of course, aren't required. You know, some individuals going through recovery choose to abstain from medication-assisted treatment, and that's okay. There still is the counseling and peer support component that is available. And then last but not least would be a peer who is able to provide support, resources, and referrals. And I would see as we would start this program, should we be given these dollars, that they would be out, you know, doing outreach and engagement in the community to find individuals that would be in need of these services. Next up is our jail bridge program. So the jail bridge program is something that really has a lot of spotlight on it right now, because if you think about it, if we can find someone who's in jail, while they may have committed a crime, they are alive. You know, they are there and we can help them at that time. And so what we would do in these cases is at a minimum have a peer go into the jail to educate the individual on the services that we can provide for the substance use issue that they're experiencing. The level of services that are provided in the jail depends on the jail desire. So at the very least, it could be an individual has an appointment and a contact, a bridge, if you will, for services post-release. Now, we're currently implementing this in the Putnam County Jail, and we are going to be providing the full continuum. We're even going to be having our APRN go into the jail one day a week to see these individuals to start the medications. The medications, there are 3 different kinds of medications that individuals who choose to use MAT can receive. That's methadone, buprenorphine, and Vivitrol. And so, again, any of those could be available. Now, with that being said, here specifically in Bradford County, we are not credentialed as a methadone provider. So if an individual was interested in that, they would have to receive that from our Gainesville clinic, which is about 30, 45 minutes away. But we could do the buprenorphine and the Vivitrol here in Bradford County. We also have a letter of commitment from Sheriff Smith here in Bradford County. We are looking at a grant that's being put out by DCF for jail bridge services, and he did sign a letter of commitment, so it is something that your county is interested in doing and committed to being a part of. Should our services be, our grant be awarded and/or we be awarded the monies that you all have from the opioid abatement dollars. Hospital emergency department bridge. So this would be partnering with local hospitals, or in this case, you have HCA Florida Stark Emergency, to intervene when an individual with substance use indication is admitted. So we would partner with them and come up with a process as to how they would communicate with us that this person was there and needed or wanted to speak with us. The peer would go into the hospital or the emergency department to meet with the individual and educate them on substance use services and what we could provide to them. And then we would bridge to the appropriate level of care, which could be detox if the individual is either a Marchman Act or needing some detox that perhaps the emergency department could not provide. And so that would require ambulatory transportation to our detox unit in Gainesville, which we would be able to provide that transportation for. Or it could be to one of our residential programs, to services, outpatient services here, and whatever we can provide, or further MAT treatment. Again, if we're looking at methadone, that would be in Gainesville. But I think we really want to focus on offering Bupe and Vivitrol specifically here in Bradford. And again, we are currently providing this service in Alachua and Columbia counties, and it seems to be working quite well. Community bridge, I put this in here, and then I remember that I talked with Bertina and someone else at Meridian that this is something we could do, and I just included it because we're doing it in other places, but I believe this is something that Purpose Behavioral Health would be doing more of, is that outreach to individuals in their home or other community setting, and really meeting the individuals where they're at to encourage engagement and treatment. You know, again, that bridge to services. So I'll let Bertina speak more about that tonight. And then co-responders. So these are trained staff, either counselors or peers, who ride along with law enforcement or fire rescue. And the goal is to reduce admission to a higher level of care, avoid arrest, or obtain the medical treatment that they need. They respond to calls and then follow up with the individuals they encounter post that initial interaction. So in Alachua County, we actually have several different teams with GPD and ASO where we have this happening, and they're specifically focused on that, those ride-alongs, and again, being able to follow up post that initial interaction. And it really helps the individual with that, perceived notion of, being afraid of law enforcement, being afraid to call fire rescue if they're in a situation where they've overdosed because, I could get arrested, I could, whatever that looks like. So this again is another option. Those are pretty much the services that we have, and again, based upon how much monies are allocated to us, we would just kind of go through that and work with the various community partners to make that happen. As far as additional funding, because of course we're just looking at year one, and again, the budget that I had allotted for, this came out to be about $215,000. But of course, we want to keep these services going, right? We don't want to get them started and then have nothing. So Meridian has additional funding and sources to support ongoing services ourselves. We have LSF, Lutheran Services, and DCF funding. We have SOAR funding, which is the State Opioid Response Funds. We also accept Medicaid and other private insurers. And then we could also look at other ways to continue these services by applying for grants. As I mentioned, we did the jail bridge grant with Sheriff Gordon giving his support for that. And then also, hopefully, additional county funds if we are awarded these opioid abatement funds. And I know that they go on for about 18 years, but of course, drastically cut, so we would need to pull from different areas to keep this going. But I think if we all work together, we can certainly make that happen. So,
All right.
any questions?
Any questions, board, board members, any questions? Okay.
Madam Chair, I have a question. Ms. Tozier, what does your current staffing situation look like over at Meridian
Here in Bradford?
in Bradford? Yes.
Yes, we have a couple counselors, and then we have an APRN who sees for outpatient psych med management, and we have a CMA that would do all of the processing for them to be seen by the APRN, but it is quite minimal right now.
Okay. Do you currently have mental health and drug counseling?
Just mental health, so
Okay.
just mostly outpatient psychiatric
Okay.
services.
Do you have a mental health counselor that's not currently working in the office?
Like someone available immediately?
Do you have one that's out right now, like out on leave, or are they both full-time right now?
Yeah, they're at full-time as far as I'm aware, and I believe they may be doing some services in the school as well.
Okay. I think there might have been some concern that came from one of the offices that there's someone that's currently out for whatever reason, and that person at this time, they can't either backfill that position or, have any other kind of part-time because of that person's current situation.
Okay, I can find out and get back to you.
Okay.
It's a little complicated because I oversee the medical services, so the substance use, MAT treatment, and primary care and med services. So I'm not always privy to exactly what's going on with outpatient, but I can certainly find out that information and get back to you as to what our current services look like. But I can tell you that there is no specific services focused on substance use treatment.
All right. Thank you.
Any other questions? No.
I was
Ms.
just going
Andrews?
to ask, how many do you see, individuals do y'all see, per week or?
So, and that's something I failed to mention. With this staffing structure and the funding that we've talked about, we could see up to 100 individuals per month.
How many do you see now?
Well, it would depend. In Bradford County, I can't speak specifically because there is no substance use services, and like I said, unfortunately, I don't work in outpatient, so I don't know. In other places, in Alachua, we have 1,500. In Chiefland, I think we have around 200 or 300. It all just depends on the various needs. But again, with this staffing structure and the monies that we've discussed, we could see up to 100, sorry.
Thank you.
All right. Mr. Ray? All right. And that you all do have staff, as you mentioned, that would be able to, if you had an emergency where someone had to, if they had to do the Marchman Act, that they would be those persons that would be able to intervene and do those assessments.
Correct, yes.
Okay. All right. Any other questions from anybody? Okay. Thank you very much. Okay.
Thank you.
All right. And next we have Purpose Behavior Health, Ms. Patina Ross.
Thank you, Ashley. Hello, everybody. Hello, ladies and gentlemen of the board, Bradford County Commissioners, Commissioner Spooner, Commissioner Thompson in his absence, Commissioner Daughtry, Commissioner Reddick, Commissioner Andrews, and to everyone present here in the community. I would like to first thank you for the opportunity to stand before you today. I'm a little nervous, but I am filled with a deep sense of purpose and passion for the proposal that I'm bringing to you tonight. as my husband said first, he came up and talked about purpose behavioral and how this has been something that I've been looking forward to, and the opportunity has presented itself. I'm so thankful. This proposal is not just a plan, but I believe that it will be a beacon of hope in our community in an ongoing battle against opioid addiction. Growing up in this community, attending its schools, I'm a Bradford County High School graduate, class of 1993, and now working in the community as a licensed mental health counselor. I count it a privilege and an honor to serve. I have over 20 years working in mental health as a crisis counselor and an adolescent and adult substance abuse counselor. Given that I do work with Meridian, I want to put this disclosure out here that Meridian Healthcare as a program manager for MRT. So we work in crisis response, dealing with suicidal ideations or SI or homicidal, and so we actually go to them and we respond in the schools and in the homes. And just want to let you know there will be no conflict of interest or competition with Meridian in serving our community. As my program is separate and not related to the services provided, but as Ashley just so pointed out, we actually will partner together, because the services that I'm going to propose tonight, we're going to be able to go into the homes, so we will be able to bridge the gap. And so, however, I do believe that is an added value because I understand the people in our community that we serve and want to help make, and I want to help make a difference. I speak to you not only as a professional dedicated to the field of mental health, but also as someone intimately acquainted with the devastating effects of this addiction. You never know how bad it is until it affects your life. I have witnessed firsthand the damage that this addiction has on individuals, families, and the entire community. And like many of you, I have felt the pain of watching loved ones struggle with this horrendous disease. In my research, I found that in 2022, Governor DeSantis had an innovative initiative approach to opioid recovery called Coordinated Opioid Recovery Network, called CORE. And I know you may be familiar with that, which is the first comprehensive solution to addiction care in the nation. And the results have been positive, reducing the number of opioid overdoses. CORE encompasses a holistic approach treating addiction as a disease. This comprehensive approach expands every aspect of overdose response treatments, treats all primary and secondary impacts of substance use disorders, including coexisting medical, mental health conditions. Many traditional addiction treatments focus on one pillar, but with this holistic approach, it focuses on so many other. That's why it's comprehensive. So you're able to go into the home. You're able to bridge the gap. You're able to treat people in a non-traditional way. Many traditional addiction treatment focus on one pillar of care, but CORE encompasses a holistic approach. And like, Purpose Behavior would like to continue in that approach, providing an in-home approach where we're going to the clients, we're going to them, we're going to them to help them to prevent, to educate, and to treat. I would like to make an emphasis on providing treatment in the home like CORE. Purpose Behavior uses a non-traditional, holistic approach where we will be able to reach those individuals that would not seek treatment traditionally. It will aid as prevention where we are trying to reach them before they need to call the paramedics. In-home treatment for addiction is a service that is not being offered currently in the state of Florida. My proposed opioid addiction treatment program is not just another initiative. It is a lifeline for those who feel trapped in this addiction. This program will be comprehensive, addressing not only the physical aspects of addiction, but also the underlying psychological and emotional factors that often accompany it. I will offer a range of evidence-based treatment tailored to meet the needs of each individual whose lives we touch. Most importantly, this program will be built on a foundation of compassion, understanding, empathy, as well as a faith-based approach. We recognize that addiction is not a moral failing, but it is a complex medical condition, one that requires support, understanding, and unwavering commitment to overcome. So, in response to the pressing need, I am proposing a comprehensive one, as I said, a 3 to 4 person team. This approach combines the expertise of a licensed or master's level clinician, a care coordinator, peer specialist, or a mental health advocate to deliver personalized care and support directly to individuals struggling with opioid addiction in their homes, as well as a registered or licensed nurse to provide medication management and education. So, the objective of this, if you got a 4-person team, 3 to 4 person team approach, you have a clinician, you have that care coordinator that will provide resources, be able to go get the resources. So the clinician will conduct initial intake assessments to understand the client's needs, challenges, and goals, develop a personalized treatment plan using evidence-based therapies and relapse prevention strategies, provide ongoing individual and a group therapy session to address underlying issues contributing to their opioid addiction, monitor the progress, adjust treatment plans as needed, and provide crisis intervention when necessary. The care coordinator, a bachelor's level care coordinator, serves as a central point of contact for clients and families, coordinating access to various services. As Ashley was talking about, Ms. Tozier, about the services that Meridian offer. I work for Meridian, and I know those services that we offer. So the care coordinators will be able to connect them if they need medical assisted treatment. And because we'll be in the home, we will be able to coordinate those services. The care coordinator, they will be able to find the resources that they need, providing ongoing individual and conducting comprehensive assessments to identify the additional needs beyond addiction treatment, such as housing. That's what care coordinators would do. They will act as a case manager. So they will be able to maybe find housing if that's the issue, or employment. Referrals, make referrals to Meridian for mental health counseling, including primary care physicians, detox programs, mental health services, medication assistance treatment, and social support services groups. This is the most important thing that so many people need that are dealing with addictions, is advocating. Someone that's going in the home, understanding. And I know so many like me have family members that have been addicted, are still addicted. Wouldn't it be nice to have a program like this where they voluntarily say, you know what, I might not go to Meridian the traditional way to seek out the treatment. But if somebody comes to you and they say, hey, I'm here to help you. And one of the priority in this population, the priority people that are dealing with, we need to get our youth that are struggling with opioid addiction, that are on meth right now. If we're able to help and assist the family, those parents where their child have gotten addicted to opioid, we'll be able to get that consent from that parent, and we'll be able to come into the home and to help that family. So we'll advocate for the client, ensuring they receive timely and appropriate care. The peer specialist provides support and empathetic encouragement to the client based on their own experience with addiction and recovery. Offer guidance, teach coping skills, strategies to help clients manage triggers, cravings, as well as build supportive relationships. Connect the client with community resources such as peer support groups, wellness programs, and other positive activities. Helps the client develop self-advocacy, empowerment, resilience in their recovery journey. The registered nurse or the licensed practical nurse conducts comprehensive health assessments, including physical exams, medication, reconciliation to address the medical needs of clients with opioid addiction, monitor vital signs, educate the client and families about medication management, harm reduction strategies, and overdose prevention. The implementation of this plan, how do we get this thing started, right? So what we do is we recruit. Thank God I have my ex-program manager here, Busil Levine, who is a licensed social worker. And so I also have another licensed mental health counselor that she's been doing substance abuse groups for many years. She also worked for Meridian. She no longer work for Meridian right now, but I have a wealth of people that I'm connected to that can really help start something. That this may be a pilot program for Bradford County because it's not something that it may be nationwide. I don't know, but I do know it's needed. So I'll recruit and train a multidisciplinary team consisting of licensed clinicians, master level clinicians, experienced care coordinators, and peer specialists, mental health advocates, nurses. Partner with local health care like Meridian providers, like Meridian addiction and mental health treatment facilities, social services, and community organizations to collaborate and make referrals, develop protocols. When you're going into the home, I've been a crisis clinician for a long time, okay? I used to work in Atlanta and where I was a part of an IFE team. And what we did exactly this, but we were doing it for at-risk youth. And so we would go into their homes, a three-person's team, and we would go in as a crisis response. I also worked at the transition house when I came back in 2017 at the transitional house here as a substance abuse counselor here in Stark, Florida. And so the protocol and procedures for conducting home visits, ensuring the safety, confidentiality of both the clients and staff, utilizing telehealth sessions when appropriate to supplement in-person visits, to continue communication between teams, members, and clients, and also implement an evaluation system to track outcomes, assess programs, effectiveness, and identify areas for improvement. Since this is a startup thing, I just want to put this out there. I understand the allocation of the funds that, the dollar amount may be small, but I believe if we start off with maybe 5 to 10 families or clients, we can see how this will help not just Bradford, but we can see how it can help all of our communities in the state of Florida. In conclusion, by using experience and expertise of a 3 to 4 person team in the home approach, we can provide a more holistic, accessible, and personalized care to clients struggling with opioid addiction. Purpose Behavioral Health Center comprehensive treatment program goal is aimed to address the complex needs of the client while fostering relationships and collaboration across healthcare systems in our community. Together, I believe, with my 20 years of experience working as a crisis counselor in mental health and substance abuse, I believe we can make a meaningful difference here in this community towards the opiate epidemic by supporting individuals on their journey to recovery and wellness. Thank you for your time.
Thank you, Ms. Ross. Any questions from the board? All right. Okay.
Madam Chair, I have
Oh.
questions.
Yes, Commissioner Doherty has a question.
Yes. And Ms. Ross,
Mm-hmm.
so when you said earlier that you will have a team that goes in, I know you mentioned there's some folks here that have worked with you in the past. So what would you anticipate as far as a team, like, 1 or 2 people going in,
It'll be a 3 to 4 person team.
3 to 4, and then the 3 to 4 are like trained professionals?
Yes, sir.
Okay.
That are trained in a clinician that will kind of oversee it, that's licensed or master's level, that have worked in crisis response and going into the homes. And then a care coordinator that will be able to provide the recommendations from the clinician. They will be able to provide the recommendations from the clinician. They'll be able to make the referrals and get the client set up on their way with treatment. And then a peer specialist is similar to like a AAA sponsor. That's what a peer would be, because they are usually a peer specialist have dealt with recovery. They're still in recovery themselves.
Okay, so you said a couple of things. That one of them was that it's not currently being done in Florida, right? Okay. Then you also mentioned this being a pilot program as well as a startup program. Is that right?
Yes, sir.
Okay. Okay. And then you also asked the question, how do we get it started, right? That was the question you asked as far as your
It
presentation.
was kind of like a rhetorical one,
Right.
but yes, sir.
Right. No, I understand that, but I want to bring that up because, again, if it's something that's not currently being done and you're considering this a pilot program and a startup, I was just, concerned about how, I know you said you have a plan of attack on this, but, without this being done and with it being a pilot program, just, what would you consider as far as any kind of metrics for success if you don't have anything, currently in place?
Yes, sir. The metrics for success is what I'm doing right now as a program manager. I've seen it work. I've seen it work in Atlanta. I've seen what going into homes is, just as your Governor DeSantis started in 22 with CORE. He's using this non-traditional treatment, and he's shown that it does work by providing these in-home services. This may be something that may not be done right now, but that's how things get started. It gets started by saying, you know what, let's take something that another program have been doing, like what I do right now currently as a program manager for MRT, Mobile Response Team. We actually do just what I'm proposing. We go into the homes. If someone is in a mental health crisis, the difference is now someone is in a substance abuse crisis. So I've seen it work. I know it works. And I've seen the results of it myself personally in the community in Atlanta, seeing the people that know that they have someone to talk to that may not have transportation to get to Meridian, that may not have transportation to get to MAT. And I'm willing, because it's no conflict, this is after hours. I already have the people that have already willing and ready to go. So if the money is given, we can start running.
Thank you.
Okay. And Ms. Ross, I know that you have worked in a similar program, but with the youth in Atlanta. So there is a replication of services that could be rendered. I know in past, with Meridian not having these, I guess, substance dollars, it limited what was able to be provided in the community. Is that correct?
Yes, ma'am.
Okay. And it sounds like you have a team of experts that could help.
Madam Chair,
Yes, sir.
so let's say after the first year, how do you see this program sustaining as far as funding?
Well, because purpose behavior is private practice, we also accept insurance. So we will be able to also reach out to LSF. I've worked with LSF in the past through another agency. We work with, I'm on the LSF grant right now through Meridian. And so I want to be able to partner with LSF. Also, we'll be able to use insurances as well.
Any other questions? Okay. Thank you, Ms. Ross.
Thank you.
Thank you.
Now we have Ms. Bradford County Health Department, Ms. Udi. Welcome.
Amy Udi, Director for the Health Department in Bradford County. I think the part of the puzzle that we play in this opioid funding as far as the settlement is from the prevention and mitigation viewpoint. We do have 2 licensed mental health counselors on staff at the health department. We do currently go into the Bradford County Jail and provide that counseling. We've received substance abuse funding through our federally qualified health center. So we are currently providing that service. We don't provide MAT, it's just counseling. We don't do medication therapy. But what we do is a lot of health education. So from our standpoint, it would be more of a prevention and health education campaign. That itself can be as large and as small as the funding that's allotted. We can do everything from billboards to newspaper articles to mail-outs to education that's provided at our hubs in our schools. We've done school assemblies that we've arranged. It kind of just varies. It's really up to the amount of funding that's allotted for that educational campaign. So we're not really looking at the treatment part of it. We have some great partners here. We don't want to take that on. We're more from the prevention, because while we have substance, we definitely have a problem with substance use. I'm really concerned about the 83-year-old that has an opioid prescription at his house that for chronic arthritis, that is taking it appropriately, has no intentions to do it any other way, but you know, people pick up the wrong pill bottle sometimes. And I would hope that everybody in the household that has an opioid prescription also has a Narcan prescription. That's another service that we give out Narcan at the health department. I hope it's locked up. You know, I hope they don't have a 4-year-old grandchild. That's some of the concerns I have from doing some of this opioid education. So not only do we have those counselors, we also, very recently with Chief Carter, have a agreement that we can do direct referrals, and we're going to have information exchanged and things where they can refer directly. So when they go in those households and see those things, and connect them back to us for those services that we provide. So I don't have a set dollar amount to ask for. It's really just as big and large as it can go. It can.
Commissioner Doherty, you have.
Ms. Udi,
Go ahead.
did Ms. Anderson?
No, go ahead.
When you said the preventative measures, is that like an early intervention in the schools? Do you have something
I mean,
that?
it should be a health education campaign. We've looked at everything from getting the doTERRA bags that you mail out to every household. We got a pricing on that. It's pretty pricey. I mean, that I think was anywhere from $30,000 to $35,000 for our population. That's where you mail a bag to every household. They have the ability to dump those prescriptions that are old, not just opioids, any prescription in a bag, mix some water, they can throw it right in the trash. It just kind of removes prescriptions out of people's houses, because we all have medicine there that we got prescribed for something and we didn't need it all, or it's 2 years old and it just happens to be we haven't cleaned that cabinet out. So we've looked at things like that. We got prices on billboards. You know, we work with the Telegraph all the time, so we know how much in newspaper articles. pamphlets, handouts, speakers at the school district. We've kind of done it all because we not only do opioids, but we do any chronic disease or, you know, health education is kind of our area. So that's what I mean when I say prevention.
You have a question? Ms.
That was
Andrews?
That was my question. How much time are you able to spend in the schools, and what kind of resources you have for the schools?
Right, for the schools, we currently send two of our counselors into the school districts. We partner with Meridian. They're the big player at the school district for counseling, but we kind of just assist a little bit on because it's a lot. So we also have our counselor go in there. We have an agreement with them. As far as campaigns, we have school nurses, and school nurses work for our office. So they do health education of just various topics. So if this was one that was funded, that would be an area that we could steer them towards. We did recently, First Lady DeSantis had us go in with DJJ and the local sheriff's department to do the Facts Your Future, the Facts Your Future. There were campaigns they did in all 67 counties to specifically talk about this issue. So it just depends on the amount of funding.
Ms. Udi, one of the concerns I had was the prevention educational materials that could be distributed through the 3 hubs that you all also operate out in Loudoun and Stark and now in the Hampton area. That information could be shared through those hubs, and then again with the school system.
Right.
And as you look into our community, we have an increased number of youth or juveniles that are abusing substances, and sometimes those result in some fatalities.
And I think the school district is a great partner because you hit a very large number of households for the county. Our hubs are a great avenue, but they are very much in the infancy of beginning. I talked to Anna this week. She's over our hubs, one of the partners with our hubs, and we had about 50 people in 3 months come in our hub here in town in Stark, and about right under 60 in Lawdy. So they're definitely a great avenue, and we definitely would want to put some stuff there. But as far as numbers, school district definitely you're going to hit a lot more households. That was part of me talking with Chief Carter because he hits a lot. I mean, he has the potential to hit a lot more households than we can hit. So I think there's lots of ways that this could go to get that message out there.
Okay. Any questions from anyone else? All right. Thank you, Ms. Udi. Chief Carter?
We'll get there. Give me 1 second. There we go. And thank you to our IT back there in the hidden room back there. Good evening, Madam Chair and Board.
Good evening.
I'm excited to discuss an initiative that has the potential to redefine our approach to public health and emergency response. The community paramedicine program I'm proposing is a proactive and comprehensive response to the escalating challenges posed by opioid use disorder and substance use disorder within our community. These issues not only threaten the lives of our residents, but also strain our emergency services to their limits. The community paramedicine program is an innovative and community-centered approach that focuses on prevention, education, and support with the goal of reducing the incidence of opioid and substance misuse. Through strategic partnerships with healthcare providers, social services, and community hubs, we aim to establish a network that provides targeted interventions, targeted interventions, ongoing support, and resources to individuals struggling with addiction. By leveraging the skills and compassion of our first responders, we can extend our impact beyond the immediate crisis response, actively engaging with residents to create lasting positive change. As your fire chief, my foremost responsibility is to safeguard the lives and health of our community members. Opioid use disorder and substance use disorder have become critical public health issues, and it is our duty to adapt in our approach to address these illnesses. I'm committed to transparency, accountability, and open communication throughout the implementation of this program. I welcome constructive feedback and encourage an ongoing dialogue with all of our stakeholders. In the folder in front of you, you'll find a sample of an emergency health record, which will be completed on every patient interaction, a draft position description for the community paramedic, a draft agreement between Bradford County Fire Rescue and our local health department, as Ms. Udi discussed, and supporting documentation of how our program exactly meets the requirements of the state. Together, we have the opportunity to pioneer a model in our community that not only saves lives, but strengthens the fabric of our community. I appreciate your attention. I look forward to addressing your questions and concerns at the end of my presentation. This mission statement, or one similar to it, will serve as a foundational element that will provide direction, purpose, and cohesion to our program. It will be a tool for inspiring, guiding, and aligning the collective efforts of all involved toward the achievement of shared goals, fostering a culture of purpose-driven success. Our mission is to lead and innovate in the provision of compassionate and comprehensive care for individuals affected by opioid use disorder. Rooted in the principles of community engagement, collaboration, and harm reduction, our program is dedicated to addressing the unique healthcare needs of those struggling with opioid use and to actively contribute to the prevention and reduction of opioid-related harm within our community by minimizing or eliminating barriers to care. What is CRP? CRP is patient-tailored care. Success is built around people care, not just patient care. The absolute focus of this program will be connecting patients to the proper resources and being the support system they need to overcome this disease. We will meet you where you are. This program extends beyond traditional emergency response and brings evidence-based, individualized care directly to the patient's doorstep. In essence, we are taking the resources provided at the community hubs and placing them in the lap of the people who need them most. Our goal will be to minimize barriers to care by tackling major issues such as stigma, whether it be the patient's first virtual counseling session or getting them admitted to residential therapy. We are with them every step of the way, reassuring them they are not alone in their fight against addiction. Technology. Let's face it, technology can be incredibly confusing, and with many follow-up appointments, counseling sessions, and intake visits being virtual, this can be overwhelming for someone whose metaphorical cup is already full. Something that may seem simple to many could be the final drop that causes a person's cup to run over, leading to relapse or failure to access the resources they so desperately need. Our team would have portable Wi-Fi devices, computers, tablets, and phones to assist patients with navigating through apps and web portals. And lastly, transportation may be one of the biggest hurdles that people suffering from OUD face. With public transportation being non-existent in our community, our team would partner with services such as Swanee River Economic Council, Florida Non-Emergency Medical Transport, or even ride-share services such as Uber and Lyft to provide transportation to and from appointments at no cost to the patient. You may find yourself asking, does Bradford County truly need this type of program? According to our BCFR database, and keep in mind this does not include the data from our future partners, in 2023, we interacted with 110 patients who admitted to illegal drug use. We administered Narcan 63 times in 2023, meaning that without intervention, these overdose patients would have most certainly been fatal. According to the State Department of Health's most recent data, there were 8 overdose deaths in 2022 in Bradford County. Also in 2022, there were 66 drug-related non-fatal emergency department visits. And lastly, in 2022, there were more than 4,300 patients, over 15% of our population, prescribed opioids in Bradford County, which exposes each of these patients to the possibility of accidental overdose if not properly coached on how to manage their medications. One of the main issues facing 911 services across the country is the utilization of EMS and the emergency department as primary care. Oftentimes, people suffering from OUD are unaware of the resources available to them, or if they are aware, they're reluctant to utilize those services due to the stigma that surrounds them. So when they're in need of assistance, they turn to EMS and the emergency department for help. This starts the no option cycle. With this repetitive cycle, a person begins experiencing symptoms, be it side effects from drug use, withdrawal, or otherwise. The patient or bystander calls 911, BCFR arrives on scene, evaluates, and/or treats the patient. And at this point, the patient may be better served by an OUD or SUD treatment center. But legally, our only option is to transport the patient to the emergency department, or they can refuse care. So the patient is transported to the emergency department where they receive care for their immediate need. Keep in mind, the primary goal of the emergency department is to treat acute illness and symptoms. They may or may not receive a flyer or a pamphlet. They may or may not receive a flyer or pamphlet for addiction resources upon discharge. They are eventually discharged home where they receive no follow-up care due to one or more contributing factors. As a result of no follow-up care, the patient eventually begins experiencing symptoms again and calls 911, thus creating the repetitive cycle. Bradford County is certainly not immune to the high-frequency 911 users stuck in the no-option cycle. I would like you to keep this next fact in mind as we move through tonight's presentation. According to the 2023 Florida EMS cost report, the cost for Bradford County Fire Rescue to run one EMS call is $730. We looked at our most frequent user, one singular patient who called us 54 times in 2023. Responses to this one patient cost our service $39,420. We expanded our search criteria and looked at patients who utilized us more than 20 times in a 12-month period, of which there were 9, accounting for 235 calls for service. Converted to dollars, our repeat responses to these 9 patients totaled $171,550. And lastly, we took a look at patients who requested our service more than 12 times in 2023, essentially once a month. 30 patients used our service more than 12 times in 1 year, accounting for 617 calls for service, which equates to $450,410. According to the National Library of Medicine, people who suffer from OUD and SUD in the United States have a higher probability of being uninsured. In 2023, we transported 279 uninsured patients, and we billed those patients for a total of $249,397. Of the $249,397 billed, we received $2,057 in payments. This equates to a 0.8% collection rate for uninsured patients. It is a high goal, but if we can reduce calls to our repeat users, many of whom are OUD and SUD patients, by 55%, that one achievement alone will save Bradford County $247,725, which would completely offset the county's debt for transporting uninsured patients. CRP breaks the cycle. Instead of simply transporting the patient to the emergency department, CRP intervenes and provides alternative solutions that will better meet the needs of the individual. And the issue of no follow-up care is completely eliminated by our program. We will focus on guiding patients to resources that will address the root of their disease, not just treat the acute symptoms. Not only will we guide them to those resources, but we will also arrange virtual sessions, in-home care, and even transportation to and from treatment. Let's talk about counseling and treatment options. OUD and SUD is not a one-size-fits-all disease. No two cases look the same, and this means that the treatment of these patients will need to be tailored specifically for the individual as well. There are 84 OUD and SUD treatment centers within a 50-mile radius of Bradford County. With transportation needs being addressed within the strategic goals of our program, why would we not give these patients every opportunity to find a treatment center that best suits their needs? Additionally, we would focus on building robust partnerships with the programs within a 25-mile radius of Bradford County. Let's explore how a patient becomes involved with our program. Call statistics. Our initial subset of patients would be the 30 individuals who used our service more than 12 times in 2023. They will receive screenings to see if they are currently or at risk of becoming OUD or SUD patients. Additionally, all OUD and SUD related calls will be flagged, and those patients will be evaluated by our community paramedic. Self-referrals. Individuals struggling with substance use disorders may voluntarily seek the help and refer themselves to the CRP for assistance. Fire rescue. Our personnel who encounter individuals with substance use disorders during emergency calls may refer them to CRP for follow-up care and support. Law enforcement. Deputies who encounter individuals involved in substance-related incidents may refer them to the CRP as part of a community-oriented approach to addressing substance abuse. And a few others to mention: emergency departments, primary care, substance use treatment centers, mental health professionals, and one of the 3 community hubs. In addition to our team being on site at the community hubs, professionals working in community outreach roles such as social workers or public health workers can identify individuals at risk of or currently experiencing substance use disorders and connect them with the CRP. Community organizations, family members and friends, and schools and educational institutions. Teachers, counselors, or school nurses may identify students or parents facing substance-related challenges and refer them to the CRP. And lastly, pharmacists. Pharmacists who observe signs of substance abuse or potential medication-related issues may refer individuals to the CRP for further evaluation and support. Establishing strong communication channels with these referral sources is crucial for the success of the CRP program. Collaborative efforts with healthcare providers, emergency services, community hubs, and other stakeholders can ensure a comprehensive and coordinated approach to addressing substance use disorders in our community. It will take work to build the needed relationships with the referral sources, but with a full-time employee whose sole responsibility is to make this program a success, it is most certainly an attainable goal. As a matter of fact, in the 9 days since this idea was first proposed, we've already established a draft agreement with our local health department, which is in your folder for review. What services will our program provide? And these are just an initial snapshot of what our team will offer to those in need. Outreach and education, community workshops, training sessions on substance abuse and prevention, and distribution of informational materials and resources about the danger of substance abuse. We'll target schools, community centers, and other public spaces. Preventative care. We'll schedule home visits for at-risk individuals and families for early intervention and education. We'll have screening programs to identify the individuals at risk of substance abuse and distribution of overdose prevention kits, including naloxone training. Treatment navigation, medication-assisted therapy support, assistance with connecting these individuals with healthcare providers for medication-assisted therapy, follow-up care and monitoring for those individuals who are undergoing medication-assisted therapy, and education on the benefits and risks of MAT therapy. Harm reduction services, mental health support, community integration, peer support, data collection and analysis, telehealth services, transportation coordination, free Narcan distribution. Utilizing Florida's HEROES program, we will provide free Narcan for public distribution throughout Bradford County. These offerings will be a baseline for this program. And quite honestly, whoever is placed in the role of the community paramedic will have my full support to explore additional service offerings above and beyond the ones listed above. Due to the termination of the Library to Go program, the library has generously begun the process of transferring the bookmobile to fire rescue in an effort to support this program. A portion of our operating budget will go towards refurbishing the bookmobile and creating the county's community response unit. This unit will be on site for all special events such as fairs, festivals, and community hub days to offer a safe space for patient intake and evaluation services. Additionally, this unit will be used for potential programs such as Narcan Thursday, where we will park the unit in a public place and provide free Narcan, as well as OUD and SUD education. Essentially, the community response unit will be a community hub on wheels, delivering services to all areas of Bradford County. We will explore creative opportunities to partner with organizations such as our local health department to take their substance abuse counselors on house visits with our community paramedic, the cost of which will be covered within the CRP operating budget. Additionally, we will tap into resources such as the LPN program at North Florida Technical College and the University of Florida's Health Disparities Research and Intervention Program to function as interns to give students a new perspective of in-home pre-hospital care. In addition to our standard data that we collect on all calls for service, we will also track many other performance measures, including engagement rates, 911 call reduction, screening and assessment, referral and access to treatment, Narcan distribution and usage, preventative care and education, telehealth utilization, collaboration and partnerships, cost effectiveness, and sustainability. Our CRP program absolutely checks the boxes. In the program folder provided, you will find Schedule A and Schedule B from the state's list of approved funding uses and core strategies. There's a check mark next to all items that are addressed with our CRP program. Our year one expenditures will be salary and benefits for the CRP, a response vehicle for the CRP, a response vehicle for the training captain, upgrading the bookmobile to a community response unit, all ALS equipment needed, IT needs, advertisement costs, and partnership with our local resources. Madam Chair and Board, the potential impact of this initiative is significant, not just in enhancing emergency response, but in proactively addressing the complex challenges of substance abuse within our community. This program represents a crucial step forward towards fostering a healthier, safer, and more resilient community. The dedication of our paramedics, collaboration with healthcare professionals, and the integration of innovative strategies will undoubtedly make a meaningful difference. We believe that by investing in the well-being of our community members, we are not only saving lives, but we are also contributing to the long-term prosperity and vitality of our community. Your continued support is invaluable as we strive to make a positive impact on the lives of those affected by substance use disorders. As our county slogan says, it's better in Bradford. Let's make that more than just words and do the best we can for those suffering from opioid or substance use disorders. With the funding available from the state, we have an incredibly rare opportunity to fund this program for up to 6 years with a minimum operating budget of $40,000 at no cost to Bradford County taxpayers. As a matter of fact, Bradford County will undoubtedly see a savings in the provision of emergency services by reducing the number of high-frequency 911 calls. I thank you for your commitment to bettering this community, and I look forward to the positive transformation that this program will potentially bring to our county. If there are any questions or further discussion, I'm more than happy to address them at this time.
Questions from the board?
I got a question.
Sure.
So Ben, how much money again is Bradford County getting this first year?
This first year, I can pull that up. All right, give me just a second.
Commissioner Reddick, I couldn't hear you. What was your question? I'm sorry.
Yeah, just, and I remember looking at it in one of the meetings we had, but wasn't it around 300,000, something like
Yes, sir.
that?
Well, yes, sir, 321,000.
Okay.
That's coming up right now. Yes, sir.
All right,
See right here.
okay. And then I see Alachua County's getting 2.1 million?
Yes, sir, that is correct.
But at the same time, you're telling us without any extra cost to the county, period, for 6 years, that we can do this, the same program you just proposed.
Yes, sir.
And again, I'll just go ahead and say this now if it's okay. But, you know, I'm all for supporting Meridian, and we do support Meridian. But also, I believe it was in our last meeting when Alachua County came and gave a great presentation. They're already fully funded before this money even started coming in. So what I'm saying, if they're already fully funded and they get 2.1 million, there's plenty of money that they could, you know, give to Meridian or anybody else if they're already funded.
And make no mistake, when I'm talking about these partnerships in this program, those partnerships will be with programs like Meridian or
Right.
Purpose Behavioral Health. I mean, that's what we will do is partner with those out, you know, reach out to those programs. And again, the health department, we already have a great relationship with them. Those are the things that we'll do with this program, is explore other options to where we're not just locking somebody into exploring one treatment center or one treatment option. Again, there's 84 within a 54-mile radius. Those are the facts.
Yeah, and also, you know, I've always noticed that if a police officer shows up at the door, people are a little standoffish, but if a firefighter shows up at the door, they're welcomed in. And so
I'll say that is what we do, right? That is something that, you know, we have. There are very few jobs or very few careers that you can enter into where, you know, it is inherently that we have that public trust, but we have to establish that trust with that person within a matter of seconds of getting on scene. It's something we're trained to do. It's something that we do every single day as we go into these people's homes, and they have that public trust, or the public has that trust for us, that when they call 911, we're not going to go in there and you know, take anything from their house, and I'm not trying to indicate that anyone would ever do that, you know, going into these homes, but again, it's just a known thing with fire rescue that they can trust us in this community.
right. And I understand what you're saying, and our police force does a great job.
Absolutely.
Sheriff Gordon Smith does a great job, but I'm just saying, if somebody's overdosed and they got drugs in their house, they're gonna,
They probably
They-
don't
I
want
don't
the
think
guys
they're
that
gonna-
are showing up. No, I'll tell you that.
they don't wanna go to jail, they wanna go to the hospital.
We don't carry handcuffs.
Right.
So there's that.
Right, so that's, all I'm saying is that just makes it a little more attractive where people would open up to y'all, I believe, a little bit more than they would anyway.
And I think we have a unique perspective of being able to capture those patients, you know, that a lot of patients wouldn't, or a lot of, may not even show up at a community hub or a resource center. This happened literally just last weekend, where we had a 911 call for a young lady who was unresponsive in the ditch, and somebody drove by and found her on the side of the road and started CPR on her. And when we got there, we administered Narcan, and she started breathing again, and we transported her to the hospital. She's one of those patients that will go to the hospital, she'll get a pamphlet upon discharge, and she'll probably never see the inside of any kind of treatment center or any kind of counseling center. That would be a patient of ours that we would absolutely go knock on that door and say, hey, we just want to come check on you, see how you're doing. How can we help you? We don't want that to happen again, right? If you don't want our services, here's some Narcan. Let me give you 2 doses of that. Keep that with you and give one to your significant other. So that way, if this does happen again, you don't die.
Thanks.
Well, I just wanted to say, I think that everyone here, like you said, has ideas alike. I mean, you're in the same business. What better person, except for or with your staff reporting to these calls, and with us saving the money on those calls, that really, I mean, makes a big impression on me. I also know that you would work with these other groups and individuals to bring this about. And with Alachua County coming and telling us what a great success they've had, I think it's a great program that you put together.
Thank you very much.
Madam Chair,
You have some more questions for Chief Carter?
I have a question.
Go ahead.
Chief Carter.
Sir.
You know, I think this program makes a lot of sense because from an auditing standpoint, as far as, you know, you being a department in the county. You know, we are, you know, gonna be looked at by other councils as far as, you know, where this money's being spent, and is it being spent for the intended uses of it. My question to you is, and that was just a point I was making, but my question to you, how often could we expect you to report back to the board as far as, you know, you keeping up with the number of calls that have decreased and where we are and where we are as far as a, you know, from a number, like a budget standpoint, and what it's saving the county and the taxpayers?
Absolutely. I would mandate that this be an annual report from, you know, that community paramedic, whoever's in that role. You know, provide that annual report, and we would present that annually. And I think, again, this funding extends out to 6 years. Again, it still allowing an operating budget of $40,000 or greater out to 6 years. And as I said last week, if this program's not a vital service within our community, and this is not something that people are truly relying on and see as a benefit, then the program needs to go away. And again, you've got my full, you know, commitment to being transparent and being upfront with you all, as I believe I have been in the past. So I think it is a beneficial program to our community, and a lot of departments are doing this throughout the state with this funding specifically.
Thank you.
Chief Carter, I guess I have a bunch of questions.
Sure.
How would you provide the clinical assessment when you're making a call in the community? Are you employing licensed clinical persons that accompany you on each call?
No, ma'am. So those would be the type things where if we get a 911 call, we respond out, we send out our community paramedicine or our community paramedic. They would arrive on scene, and then we could schedule a time either with, you know, immediately we could do an on-site evaluation, which is done through the SASMA website. I believe it's the acronym, but you know, they have those evaluations there that we can absolutely use to see if this patient is either a current substance user, opioid user, or is at risk. We also would offer those telehealth services to where we would have those partnerships already built to where if we had someone who was truly in crisis, we're not leaving that patient, we're not going anywhere until we get them to the places they need to be. But that would be, you know, those evaluation services would either be done, you know, by our personnel on scene initially to say, you know, they are not, there's no evidence of substance abuse, there's no evidence of any kind of at-risk substance abuse, or yes, there is, and let's get them on a telehealth call with someone who is, you know, able to do those official evaluations.
Okay. The reason asking that, when I served as a clinician here many years ago, we went on the calls with the emergency personnel,
Sure.
or met them at the hospital, or you know, went with the sheriff deputy to do an immediate assessment at that time and then make the referral. So how, if you determine that the person were needing treatment locally, where would you refer them?
Well, and again, those partnerships will have to be built. I honestly don't have all of the resources listed in front of me because, quite frankly, we've put this together in 9 days. But again, we would partner with the health department, partner with Meridian, partner with all of our you know, local resources, but additionally partner with you know, outside resources from outside of our county as well, to get those patients to where they need to be. Those transport services would either be handled again by any of the number of services that I listed, or again, it could be something as simple as calling an Uber or calling a Lyft and getting them to that place, and us following them over there, making sure they get there safely and they actually walk through the doors of the treatment center.
Okay. And the other thing, if they're needing the outpatient services, I know in an emergency situation, they're gonna either go to Meridian, you know, to Lake City, or if they're youth, or in Gainesville, to go to those places. But when they're needing the outpatient services locally, how would you help in that regard?
So again, those would be the outpatient services. Are you talking about like follow-up care and
Yes.
things of that nature, right? So we would schedule those telehealth services. Let's say that they have a follow-up appointment with the doctor's office here in town. We'll be there at their house to make sure they're up at 7 a.m., getting in the truck and going to that outpatient service. If they don't have a vehicle or don't have a driver's license, which again, a lot of OUD and SUD patients do not, we'll get that transportation to and from those doctor's appointments at no cost to the patient.
Okay. One of the most effective modes of treatment for substance abusers is a face-to-face. Telemedicine is not criticize, but not an effective intervention for substance abusers. They manipulate their way out of that. So that would be a concern with the focus on just the telemedicine. And I know it's a service that is offered for medical services, but in Bradford County, we've never had true, substance abuse funding locally to treat people here without having to transport them far to Gainesville, to Lake City. But this is an opportunity that we have that we can provide in Bradford County. I know that in looking at the funding up there, the $321,000 is through the managing entity of LSF.
Right.
But Bradford has an additional $130,000 that's in-house that has nothing to do with that. I did hear from the Alachua County that you presented last week. That program was fully funded by the city without opioid abatement funds. Though they have access to some, they didn't take away from that. Gainesville have a population of over 230-some thousand, but they probably have 30, maybe exaggerating a bit, but different types of treatment, including your VA and SHANS and inpatient, outpatient, housing, different programs that Bradford doesn't have. So their funding would take care of all of those different entities, and of course they can provide for Meridian. But this is specifically for use in Bradford. When I look at the opioid abatement goal, is to expand the availability of treatment. And then, to me, it would be important to provide the treatment locally and to support any evidence-based services that adhere to asthma. So we're looking at how we measure that and show evidence that this is being effective. The other goal was to improve the oversight of the treatment for opioid addiction, and then to provide, wraparound services. When I look at the 3 hubs that we have in Bradford County, our health department, the Meridian, the Purpose Health, all of these, I said all, the few services that we do have, we have a unique opportunity here for the first time ever, so that we are not limited to one form of intervention. I applaud you for proposing a paramedicine type program, but the county needs more than that. So we have an opportunity to have all of the programs that have been presented here tonight and still have what you're suggesting. I'm suggesting to you and to the board, let us do the right thing by the funding that is allocated to the county so that we can help all of the people who needed help. You're going to have some people who will not go to traditional treatment, some who will not respond to you as the paramedic. So you need people from different aspects, but they may accept someone going into a home, but they may not go over to Meridian. So we need to capture all of the aspects of treatment, and we can do that with the funding that we have here and the funding that we have with the county. That is the best, that is a win-win for everybody. And if we did that, we would be doing right by the funding that is being allocated to our county. Their priority was for medication-assisted treatment, coordination of the opioid bridge, hospital bridge programs, peer support, recovery, community organizations. So when we put that together, it's not a one type of service for everyone. But with all of the various programs that have been presented tonight, we can do all of it. And I guess I'm asking you to be supportive of that concept. But it would still allow you, with the $130,000, to still do what you're wanting to do. But at the same time, it doesn't take away the funding from Meridian or Purpose or from the health department to do their part as well. So we have to collectively work together in that effort. And I guess I'm asking the board to support that effort so that we will have a well-rounded, wholesome intervention for opioid addiction that we've never had before.
Completely understand. The 130,000 that's the state funding will not purchase cardiac monitors, ALS equipment, and provide for a full-time employee in that position. Now, I discussed this, I believe, a little bit last week, but for this program to really be successful, it has to be a full-time person in that position. It's not something that could be added to the duties of someone who's already on our payroll. That is something that would have to be a dedicated full-time person to this effort. So while I agree with you 100%, I think that we should absolutely support every effort that we can to mitigate this problem. That 130,000 won't sustain that full-time position.
And I did hear, I think from from Mr. Savor, the Meridian person or the clinician could be one of those persons, that a sister went with you guys, and that would be a cost from that group, not necessarily from the funds.
Well, and that was my thought, right? If we were going to send out, schedule a time where Meridian does go out with us, or the health department, their counselors do go out with us, and we pay for that. We pay them, if it's, $100 an hour to bring their counselor out, we pay them that fee for that time that we use them. If we find that to be an effective, mode of treatment, then we utilize that more often. And that's where that operating budget would be, flexible, and it would have to be, on a trial basis as far as building this program. But we don't really know what, as far as what kind of impact it could have without digging more into it and getting that plan in place and those partnerships in place.
Right, and essentially, as Commissioner Doherty had mentioned, with the purpose, it's more of a pilot that you would be trying to see if that could be working, that could work for Bradford County. So I'm merely suggesting to do a part of what you're asking, but at the same time allow for a well-rounded treatment intervention from the other agencies.
Madam Chair. And Chief Carter, I don't think you were suggesting taking funding away from anyone. I think that you had also mentioned that you would partner, with these other agencies. So, I wouldn't have any concerns about that. But anyway, that's just you made that point, and I just wanted to emphasize that that's where we are right now. And as far as funding and with the health department and with Meridian, Ms. Ross mentioned Purpose Behavioral Health, currently, taking insurance and, things like that. So again, I don't see you pulling anything away from anyone, but I do see your willingness to partner, with all the agencies. So again, I'm in support of your program because, again, I wouldn't call it a pilot program because Alachua County came in and they showed, exactly how their programs run. So
there's over 50 of these programs across the state that are proven to be successful programs. But as you said, we're certainly not trying to deviate funding from anywhere else. or divert funding from anywhere else, but we certainly want to build those partnerships with these community resources and get people the access to those resources. The problem is, you know, with the community hubs, how do they get to the community hubs? How does that information at the community hubs get to that person? And again, we meet them where they are. We go into their homes already, and that's just, I think that's the missing link with Bradford County, is that we've got to get that information that is in those community hubs into the homes of the people who need it.
And the most critical piece is the follow-up and the intervention piece. So while Commissioner Doris said you are not trying to divert any funds, but if you encumber the $321,000, that would take away all of the LSF funding, and then plus the $130 that the county holds. So that would take away all of the funding. I guess I'm gonna ask, are you opposed to having our local mental health to be able to provide substance treatment so that people don't necessarily have to go out of town?
Oh, no, ma'am, not at all. I certainly want, my heart is for this community and to make sure that these people are taken care of and they get the best care possible. My question would be, how is it sustainable?
Okay.
Our program is absolutely sustainable.
Okay.
And that's, again, that's just with funding from the opioid abatement funds, right? There's state grants out there. You know, they are looking at legislation for being able to bill for these services eventually. But right now, this is a free service that services across the state are providing to these patients.
Okay. The other thing was that if you're providing that, your paramedicine service, I know that you had, I guess, like about 48 calls that were possibly opioid-related type of calls. But when you look at the other piece of the missing piece of the people who don't call.
911, right.
Yeah.
And that would be addressed with those referrals, right? So the hospitals, upon discharge, if they get someone who is a general illness because they're starting to have withdrawal symptoms, our community paramedic would go to the hospital, interact with that patient, establish a relationship with them, and then when they get discharged, instead of just getting a pamphlet, they're going to get Narcan, they're going to get access to our program. Same thing with the jail, right? If they go, if it's somebody who is a drug user or suffers from OUD or SUD, is getting released from jail, and, as soon as they get their clothes back, their street clothes back, they're going to have 2 things of Narcan sitting in there with them. I mean, obviously, these are things that are just ideas. I mean, this is something that we've come up with in a short amount of time. That again, it is exciting to me to think about what a person fully focused on building this program could do in this position. And it certainly has to be the right person as well. So that's program success is very dependent on who would be in this role. But those are the type of programs that we're looking at, and trying to connect the missing pieces in the chain of this battle against this disease.
For your paramedicine person, what is that annual salary?
So I have the breakdown. Let's see. And it fully depends on who is actually put into that position. But as the general numbers for this program, we took, I'll zoom in a little bit more. Can y'all see that okay?
My poor eyesight. So what is the salary for that one person?
The initial starting salary for that position would be $64,000, and that is a lieutenant within our department, somebody who is already working for our department. It would be a promotion for them to go into that role. So that is our average our average hourly rate, and then it's a 6% increase for promotion to lieutenant. And the promotion piece of that is because of the fact that if this person's going to be on scene making transport decisions for this patient, we want them to be able to have that authority, to have that decision-making authority. And this just gives you a breakdown here. I've kind of color coordinated everything, but as you can see here, the year one, if we look down here at the bottom, I'll zoom in on that a little bit more. So year one, this is the LSF funding. This is a little bit confusing because this is years 1 and 2 of the city and county state funding. So this is last year we did not spend. This was left in the account. So this is last year's and this year's funding combined is $131,000 from the city and county state fund. And then from LSF is the $321,000. So the total available is $452,000. I'm just going to use round numbers. Salary benefits, so that's the full salary benefits package of that community resource paramedic position is $119,327, and then that would leave $333,000 left over for operating budget. And that would include, in this initial year, of the equipment purchases, those advertising costs and things to get the program actually started.
Madam Chair. Chief Carter, you mentioned the 6-year program, and then we talked about the 1-year reporting back as far as the effectiveness of this program.
Correct.
If the program were to fail, do we pull the rug out from under it at the 1 year, or do we wait till the 6 year?
I would say probably give it 2 years. I think after 2 years, we should have enough data and evidence to say this is a successful program and we're making change, or we're not.
Okay.
I would defer to you all, though.
Well, we talked about 2 programs, a 1 year and a 6 year.
Sure.
But you mentioned in the 2, I would be
Okay.
okay with the 2 year, but certainly not 6, and then,
Sure.
but
And my
have
thought
something after, a short period of time.
Right. And my thought behind the 6 year is just saying that this 6 years gives us enough funding from both sources of the opioid funds to sustain this position. Again, no cost to Bradford County taxpayers, and leaving a $40,000 operating budget for that role.
Okay. So, Chief Carter, you are aware of the reporting requirements under the LSF funding entity?
So we've confirmed that all of our emergency health reports or health records that we do automatically fall into that reporting requirements. If you ask the Attorney General's office, or if you ask LSF as far as the reporting requirements go, they're very loose and very broad right now, but they've assured us that what we already collect, in addition to the data that we're going to collect with this program, they said is more than adequate for what they're looking for.
Okay, and it's separate from the funding requirement that the county has, which I know it starts, I think June of this year?
The way the statute reads, there is a reporting requirement of how the plan will be implemented June, and then in August of any expenditures.
Right. But they don't actually have it broken down as to what's required for the data collection. It's still, they're working those, DCF is working through those issues right now of the exact metrics that they're looking for, but that's not actually outlined anywhere yet.
Okay. I think you'll find that LSF does have some reporting requirements that are broken out. But again, I've asked you some poignant questions, but again, I have to emphasize to the board that we have an opportunity to provide a broad array of services here in Bradford County, and I implore our board to allow these agencies to be participants and recipients of the LSS funding as well.
Yes, ma'am. And my goal here tonight was just to present you with an option. So it is your decision as to what you do with those funds. Any other questions for me?
Any other questions?
And let me just say this. All 4 proposals tonight were excellent. I thank you. I thank every one of y'all. Thank you back there. All 4 proposals are awesome. But from listening to all 4 of them, and from what I'm hearing and seeing, it seems to me like the best benefit to the actual citizens of Bradford County would come with your proposal that you just made now, simply because you're there right from the start. You're the ones that's gonna be going and picking up these citizens and taking them to the hospital or Narcan, whatever they need. You're gonna be there right from the start. You're gonna see the patient. And, like I said, all these proposals are excellent proposals. But in my mind, I really believe the one that would benefit our citizens the most and be more hands-on than any other program, and also with working with all the other ones, would be the one you just presented tonight. And with that, if you want a motion, I'll make a motion to move it forward.
Well, I haven't asked for one, but I will just now. But I also want to employ Chief Carter. I know that we're in a unique situation in trying to seek funding for fire rescue, but I want to be absolutely clear that the funding intended for the opioid abatement is not to address the funding shortage in fire rescue.
100% agree.
Okay, and that it is supposed to be specifically for opioid intervention
Yes, ma'am.
only. Okay.
Any other questions?
No, that's not it. But I'm asking for a motion to support all of these agencies' requests for the opioid addiction funding, including Chief Carter.
I'll make a motion to support the proposal that we just was read by Chief Carter, and that would be my motion for that to be our sole source, is to the proposal that Chief Carter has presented tonight.
I'll second the motion.
There's a motion on the floor by Commissioner Reddick and second by Commissioner Doherty to support Chief Carter's proposal for the opioid abatement funding. And I just for the clarification of the motion, are you suggesting all of the funds in all categories?
Yes, all the funds, whatever he needs to get it started, but also, like Commissioner Daugherty said, I would definitely like some follow-ups, and especially annual reports, and then in 2 years, if this is not working, we need to move in another direction. And that's my motion.
Okay, there's been a motion and a second on the floor. Any further discussion? I have the authority there. That it's going to be important that the funds are appropriately used, and to wait a year after or 2 years is too long of a period to evaluate whether something is working. And the reporting requirement is certainly going to be sooner than a year. So you'll know in a few months or 6 months or within that first year that it's not working. Okay.
Madam Chair, I think Commissioner Riddick in his motion said 2 years.
Yes, 2
Is that
years,
right?
but also Chief Carter said the first year he would give us an annual report and tell us how it's moving forward.
And if I may,
Commissioner
and I would
Andrews.
strongly suggest that you did, as you had said, that you would in hiring the counselors and everything from the other units or from the other entities here tonight.
I didn't think he said that.
Yes, he did.
Yes, he
He
That
said that
you would
he
hire them?
He would hire,
Not, but you wouldn't be
Counsel.
hiring them.
yes, that's
No.
what
He's saying,
not hire them, pay them, I apologize. You said that you would pay a counselor $100 to respond to that, to a call with you. Okay.
okay.
No, what my statement was is that we would employ their services, right?
Right.
So, health department, be it Meridian, a counselor, whoever it would be, pay them whatever their hourly rate would be to respond out with our community paramedic to house calls or house visits.
Right.
Right, but not employ them as an employee of Bradford County.
no.
Correct.
I'm sorry, I didn't say it
Nope,
as well
all
as
good.
you, Mr. Carter.
All right. The motion and the second is on the floor. Are you all ready to vote? All in favor of the motion by Commissioner Reddick, motion by the sign aye,
Aye.
Aye.
and nay. My vote is no. Okay. Okay. All right, moving on to the clerk's report.
We have nothing to report, Madam Chair. Just keep in mind, budget season's upon us. It'll be here, and deadline's about 3.5 months away.
Sheriff, I don't see anyone. County managers report. Mr. Cornegay.
Thank you, Madam Chair. At the last meeting, you reviewed a draft of the updated and amended board policy. We've got the final version in front of you for approval. We would need
You incorporated their suggested changes.
some, yes. And the suggested changes have been made, and we would like to ask for a motion and a second for approval and a vote.
I make a motion that we approve the amendments made to the,
Okay, there's a motion on the floor by,
it's okay. Say that again. I did too. Approval of the amendments to the Bradford County Board of County Commissioners, and that we adopt it as it is.
motion by Commissioner Andrews to adopt the amendment to the Bradford County Board of County Commissioners Rules and Procedure. And that was second by you, Commissioner Reddick. Okay, any questions, discussion? All in favor by the sign aye.
Aye.
Aye. 4.
That's all I have, Madam Chair. Thank you.
Okay. And the county attorney, Mr. Crandall.
You know, just briefly, Madam Chair, I just wanted to let you know, as you know, our law firm is the county attorney. For some of the first Tuesday meetings, I'm most likely going to have a scheduling conflict, so you may be seeing my partner, Rob Bradley, attend to some of the meetings, but we talk about everything that works with Bradford County on a more than weekly basis, so I'm confident that you shouldn't have any problems if he has to sit in if I'm having a conflict. But if you have any questions, I'm still your point of contact. You can always just give me a call. Thank you.
Okay. Commissioners? No? Commissioner Reddick?
I just want to say one thing. I thank everybody for being here tonight, and I know a lot of y'all are concerned about the assessment, just like I am. I got to sit up here and take the shots. So I'm definitely concerned. I agree with you, Mr. Tatum. The franchise fee is by far the most fairest tax that we could do. But unless y'all have some pull with Clay Electric, our hands are tied. We did not pass it on Florida Power and Light because it wasn't fair to pass it on one and not the other. But like I said, that would definitely be the fairest tax, there's no doubt. But at the same time, I also know that we have excellent service in Bradford County for fire and rescue, so we have to do something. I will tell you this, the only thing I'm hoping with this assessment, that we can definitely lower the millage rate, so people that are paying high taxes on their property taxes, that we can lower that, maybe help offset some of it. And also, I haven't even seen the proposal from Mr. Olive yet, so as far as your buildings and stuff, I don't know, Mr. Tatum, until I see what he's proposing to us.
Mr. Tatum, I'm sorry. This is reserved for the commissioner's comment, and then Mr. Reddick could speak with you afterwards.
Yeah,
but-
and I'm sorry, I shouldn't have mentioned your name, I apologize, but anyway, that's the one thing I just wanted to say. And again, I thank everyone for being here tonight.
Mr. Doherty,
I don't have any comments, thank you.
Commissioner Andrews.
Yes, I do. And it's along the lines with Mr. Riddick. I have been out to the sawmill, and I have saw the buildings that is being talked about tonight, and I totally agree. It's ridiculous that we would put a tax on those that's nothing but a cover. I mean, there's poles like a little shelter. It's not a building. And so, just so you know, Mr. Corrigan and I have had a discussion about that very thing. And I did express that I hope that we have some sort of room where we can talk about adjustments on situations like yours. Another thing on the Clay electorate, Mr. Corrigan and I called for a meeting. They finally gave us a meeting. We went in, spoke to them, and I will share with you what they told us, that their decision was based upon the survey that they sent out, that it belongs to the people, and the people didn't want it. And so that's how that happened. But like Mr. Riddick said, this is a very hard thing for us. We know it's got to be done, and I promise you that we are going to try every way we can to make it as fair as possible. We do want to lower the property taxes, and we hope that in some method of doing this will allow us to do that. Also, there was one other thing that I kind of wanted to clear up about the transition from the city police to the sheriff's department. The county was not involved in that. It was a proposal made by the city to the sheriff. The sheriff explained what he could do it for, and it was done in their meeting. The county had nothing to do with that. We weren't asked, and we didn't vote, and so just to make sure that you understand, that was not a county decision. But again, thank you for being here. Thank you for voicing your opinion, because it does mean a lot to us. It gives us something to look at and work from, and I hope you know that we do have your best interest at heart. So thank you for being here.
I'd like to thank everyone for being here, and particularly Meridian Behavioral Health and Purpose Behavioral Health, the Health Department. I make a public apology to our community, to Bradford County, for our county missing the boat here and doing the best and maximizing the use of those funds for our local community. That's my apology to you and to the community. I hope the day will come when we have funding that we can fund our local agencies who are providers of the service. But I do thank you all for coming and presenting your proposal. And I look forward to your continued service within our community. And with that, if there's nothing further, this meeting is adjourned.